Monique, you broke it down very well, and the one thing again that we talk about here is the governor was very non-specific, really, about specific dates, which so many people really wanted to hear. They did not hear that today, other than through May 3rd it will perhaps continue. Well, you mentioned testing. UW-Medicine opened COVID-19 antibody testing to the public today. Now, it can tell you if you've already had coronavirus for people who are really not all that sure about that. KIRO 7's Dee Sun dug into the confusion on who can get a test and how.
I've reached out to several hospitals in the area, and we've heard from some of you that it seems like many doctors don't know about this antibody test yet. That's something UW-Medicine says it is working on. UW says, however, it has already tested more than 1,000 people for the COVID antibody just today. This test out of Abbott Labs in Chicago is being rolled out in Washington right now. UW-Medicine's virology lab evaluated this test, saying on Friday it can detect whether you've had the virus with near perfect accuracy.
Showed a sensitivity of 100% and a specificity of 99.6%.
This website where your doctor can order a test for you is now live. You have to get a vial of blood drawn, and that gets shipped to the labs at UW. Once they get it, results for whether you've had COVID-19 come within 24 hours.
This test is most useful to identify those people who have had the infection previously and are better. It's possible that this could be part of workplace back to work efforts.
Scientists say the specific antibody they're testing for is the IgG protein.
Having these antibodies is clearly going to allow people to have a higher degree of confidence. For example, being a first-line health provider, being a first line in the grocery stores.
However, today the state cautioned there's still too little we know about coronavirus antibodies to say how the test can help reopen the economy, and cautioned even having the right antibodies does not mean you can go right back to work.
But is that enough to say, don't worry about going back into the public, you can't contract COVID-19, or if you contract it, you can't spread it? I think those are uncertainties that we don't know the answer to.
Scientists say what they do know: if you've already had COVID-19,
having those antibodies should give you some protection.
They're still working to roll out communications to let all major healthcare providers know this test is available.
I think frontline people who are at places of high risk really should be tested so they know their status.
And UW says it is ramping up testing. In the coming weeks, they'll be able to test 12,000 samples every day. In Seattle, Dee Sun, KIRO 7 News.